Hello and welcome to episode 64 of the Virtual Velo podcast with me, Emma Martin, and my co-host, Chris Schranker. Well, I say my co-host, you're going to have to hold on a few seconds because today we have a truly inspiring episode lined up as we welcome Cody McKay, the founder of Project Heart, a charity dedicated to raising awareness about the nuances of cardiac issues that affect endurance athletes. Cody McKay, a 33-year-old competitive cyclist from Ottawa in Canada, faced a life-altering diagnosis in 2021 when he found to have an ascending aortic aneurysm. This serious heart condition led to open heart surgery in December 2022, during which his aneurysm was successfully repaired. Remarkably, Cody returned to cycling just 6 weeks post-surgery and resumed competitive racing by May 2023. His journey inspired him to establish Project Heart, an initiative dedicated to raising awareness about heart health amongst athletes and supporting those affected by cardiac conditions. Joining Cody today is our very own Chris Schranker. See, I told you had to wait a few moments, who shares a very similar journey, having undergone cardiac surgery himself.
The interviewer becomes the interviewee. And this is going to be a very special episode for me. And I hope it is for the listeners also. I can't believe it's already been 7 months since I told everybody who listened about my triple bypass. This experience has taught me so much about myself, physically, mentally, and emotionally. It is, without a doubt, the hardest thing I've ever been through. But in many ways, it turned out to be one of the best things that could have ever happened to me. And I'm so extremely grateful to have this platform to share my story, because if it even helps one person, then every moment of this experience will have been worth it to me.
Cody, welcome to the Virtual Velo podcast.
Thanks so much for having me.
Cody, let's start with your story. Your story is nothing short of inspiring. Can you take us through the moment you first learned about your heart condition and what that journey back to health has looked like for you?
Yeah, absolutely. So back in 2021, I had been dealing with some shortness of breath that was by no means completely disabling. I was still riding my bike, but I was struggling with hitting some targets on my intervals. So there was some work undertaken to see if I perhaps had a lung infection. I had a chest x-ray done to look for any sort of infection in the lungs. And what came back from that was this idea that my heart looked a little bit off. So despite not being the focus of that x-ray, there was a kind of thought that maybe we should double check this. As a 29-year-old at the time, I didn't think much of it. I went for my follow-up test at the University of Ottawa Heart Institute here in Ottawa, Canada. I had an echocardiogram done, waited about a couple of weeks, and then I heard back that I needed to get a CT scan done. And it was around that time that I was starting to think, okay, this seems like a lot of tests for a non-problem. I'm having issues breathing, not issues with my heart. My heart rate seems fine. But it was after that CT scan was done that I was told that I had an ascending aortic aneurysm, and I was going to have to stop what I was doing, stop the training, stop thinking about racing coming back on the horizon. At that time, it had been canceled because of COVID, but it was expected to come back later that year. And so, that really threw me for a loop. And one day I thought I had a very minor nuance that I needed to kind of get fixed to wondering what the rest of my life was going to be looking like.
So that journey back to where you are now, just for our listeners, Cody, how long has that journey taken you?
So the time between diagnosis and surgery was about 1.5 years. Because of my age and my athletic background, it does kind of remove some of the reasons why an ascending aortic aneurysm could have formed. But so that there had to be a bit of kind of background research done to figure out what could have been the cause for me, because the treatment options and the path forward would look different based on what the outcome was. So during that 1.5 years, I had a number of other tests undertaken to look for other signs and symptoms of different things. But ultimately, went ahead with the open heart surgery on December 5th of 2022. As you mentioned, about 6 weeks after that, as the sternum had started to heal enough to hold enough weight for me to hold on to the handlebars, I was able to very gently and under medical supervision get back onto the bike and jump back onto Zwift.
Wow, it's an amazing story. And Chris, no two experiences are the same, but there are often parallels. How did your journey compare to Cody's, and what are the biggest lessons you've taken away from it?
Yeah, it's interesting that you say that, because I had a very strong family history. I went and got baselines. My father passed away when he was the same age that I am now. I always knew that this was going to be my fate, but I didn't have a single symptom I didn't have shortness of breath. I didn't have chest pain. I had recently come back from a trip down south, and I was riding the best that I've ever ridden in my life. Everything wouldn't have in any way pointed me towards what had eventually happened to me. I was racing, and if you know how, racing indoors, my heart rate was spiked up, for prolonged periods of time. It's very intense. So I just went to see the cardiologist for one of my routine follow-ups, and he says to me, well, everything looks good. We do the routine echo, we do the EKG, everything is fine. Nothing that I can't explain away with an athlete's heart, which we're going to get into a little bit later. But you know what? There's this test that we do called a coronary artery calcium scan. Why don't you go get one of those? And I was kind of like, yeah, I don't know. I don't think that's really why would I do that? He's like, oh, it's a simple thing. You just go there. It's like an x-ray. You just go. And I really think it would be a good idea. So I begrudgingly went, and it was a simple thing, super simple. And we're going to talk about it more because, kind of as an aside, said, why don't you go get this test, is what eventually saved my life, because it showed that I had the potential for blockages. And from there, I was sent to get a cardiac catheterization. And all the while, I'm in the hospital setting up for this procedure, and everyone's coming over to me and saying, oh, you're in such good shape. I'm sure that you're an athlete. This is just going to be a formality. We'll get you in and out. So you're kind of halfway sedated during a procedure like that. And the doctors and the nurses around me, you can see that the tone is changing in the room. Even though I was kind of whacked out, I could still see what was going on. I was aware of it enough to know. And there was no stents, which I figured, that's like the first line of defense is you get a cardiac stent. The procedure started and ended, and they wrapped me up and sent me back to the recovery room. And that's where my life basically was upside down. And it's the journey that I'm on now.
Well, Chris, you've become such a strong advocate for heart health and awareness in the community since what has happened to you. What drives you to share your story so openly, and how has the cycling community responded?
Well, I think that what drives me to raise awareness is that, it's just basic premise that if it can happen to me, it can happen to anybody. I've trained a lot. I'm meticulous about my diet. My father never got to meet my son, and he's 25 years old now. Back then I was not the athlete that I am now. I was certainly health conscious, but in a different way. I was an NCAA soccer player. I was lifting weights to be bigger and stronger, not necessarily cardiovascularly. But I've basically changed myself as an athlete because I knew that wasn't sustainable considering my cardiac history in my family. I wanted to be able to tell others in the endurance community that we aren't invincible. We aren't immune to these things. It happens. And there are ways that you can prevent it from happening with just some very basic routine screening exams.
Cody, you were nodding a little bit there as Chris was talking. I'm wondering whether that sort of says to me that there are some similarities around, particularly looking like an athlete, looking like there's nothing wrong that Chris is talking about. Was that a similar story with you in terms of the response of other people?
Absolutely. I mean, in my own experience, that was kind of the first thing that I really had to grapple with was how do I, as a 29-year-old athlete who is competing at a fairly high level, taking good care of their bodies, not doing any sort of quote unquote unhealthy things, doing all the things right, and then to face a diagnosis like this, it was really a big disconnect for me. But it also made me realize that, as Chris said, none of us are entirely immune to it. This game of life, we all come with a different set of hands. In my case, I had a very minor congenital birth defect on my aortic valve that was previously not known. And so that aneurysm had been slowly growing over multiple years, had not been discovered. Yeah, I mean, we don't necessarily know. We don't know how that hand of cards changes as life goes on. There's so many different factors that we can be exposed to, both ones that we're, intentionally perhaps involved in or unintentionally involved in, just even exercising in a sport outside where there's, car emissions in an urban setting. Like there's so many different factors that we may not take into account on a day-to-day basis. I think particularly in that athletic community, it is really hard to think about the reality that this type of thing, any type of thing, related to the heart, an electrical problem like an arrhythmia or a plumbing like problem like what Chris and I had, that those things could happen. And trying to close that gap between the perhaps naivety of that, I think that goes a long way to getting folks to respond quite quickly. If something feels off, it's okay to ask and have that second opinion or have that kind of thought about and looked into.
Chris, you talked about tests there and about a coronary artery calcium scan. Can you explain to our listeners what that actually is and why it's such an important tool for cyclists?
Yeah, I think that the reason why it's so important is that it's an easy thing. It's cyclists, they don't want to like break their routine even to go see the doctor. We're healthy, nothing can happen to us. But this is a very easy thing. And basically, I had to learn all about it because I didn't even know that it even existed. But because of plaque buildup in your arteries and the inflammation and the damage that that causes, there's calcium that gets infiltrated into those areas of your arteries, and you develop what's called arterial calcification. And the coronary artery calcium scan detects how much calcium is in your arteries. And people that have none, that's supposed to be indicative of no plaques, no blockages. The score goes up to 400 plus. Above 400 is that you're at a high risk for cardiac episode. Mine was 600. And that's the reason why I was sent directly to get that cardiac catheterization, which the reason why there was such a solemn tone in the room when I was there is that I was shown to have multiple 90% blockages in all arteries. Just picture that, a guy that, for whether it's good or bad, rides 300 miles a week and had been doing that for 25 years and racing at a high level and presently racing. I was basically a ticking time bomb at that point. The period between when I received that news and the surgery, which was only a week away, was the most agonizing, grueling period of time that I've probably ever gone through. You know, we were just like walking on eggshells. And of course, I didn't stop riding my bike. And I'm going to say that because I need to be honest. But I was very aware of my heart rate and other things. But it's one of these things where it's such an easy thing to do. So if anybody listening to this gets anything out of this conversation, it is that you should go get a coronary artery calcium scan. And the reason why I say that, and the reason why I mentioned in the opening about this being one of the best things that could have ever happened to me, is that it not only changed the relationships that I have with my family, but it's also allowed me to use it as a platform to raise awareness. And I know that Cody has also, and we're going to certainly get into that. But I think to this person who messaged me directly after reading one of my posts, and she says, I sent my husband for a coronary artery calcium scan because I read what you wrote, and he just got out of surgery. He had a bypass and he's having a rough time. What can you tell me that I could tell him? Because I've been telling him everything about your story and everything that you're doing. So it's powerful. It's something that you should do, and just keep an eye on it because you never know.
Well, it's one of those things, isn't it? It's knowing what to ask for as well that I think is important. Often I think people have heard of an ECG, you've heard of a CT scan. Hearing as something as specific as a coronary artery calcium scan is something that a lot of people, well, they won't have heard of until someone has mentioned it. Cody, you've turned, Chris is talking there about the impact of telling people and wanting to raise awareness. You've turned this into a bit of I want to use the phrase personal challenge, really into a movement with Project Heart. What inspired you to create the initiative, and how are you using it to connect with the endurance athlete community? Tell us more about Project Heart itself and what you're doing and the impact it's having.
Yeah, absolutely. I was quite quiet about my diagnosis, essentially right up until the surgery. There's a little bit of, for lack of a better description, guilt or shame associated with it, feeling like I had done something wrong, despite, not doing anything wrong or being othered or different than everyone else. There was a lot of mental challenges in that kind of year and a half between diagnosis and the surgery. But obviously, once you're having open heart surgery, it's kind of hard to hide that fact. But I kind of made a commitment to myself shortly before the surgery that I should start sharing my story, even just informally on social media. Because one of the things I really struggled with was that lack of relatable experiences. When you look into things like open heart surgery, a lot of the online literature focuses on elderly populations, survival rates, things like that, which are all well and good when you're dealing with perhaps a more elderly population, buying a couple more years of life with the family, things like that. But I needed a more specific example of what am I as a young athlete going to experience on the other side? Maybe the survival rates are great, but will I ever get to ride my bike again? Will I ever get to race my bike again? Will I get to push myself to the limits? Something that I was so used to doing before the diagnosis. That qualitative level of story is what was lacking for me. And so I thought sharing that and just the journeys and the steps along the way will probably go a long way to, maybe help someone else if they end up finding it. And the outpouring of support that came on the other side, it just was like a snowball where more and more folks started reaching out who had gone through a similar experience, who maybe came from an athletic background, or at the very least were really struggling with this diagnosis and how it disconnected them from their sense of self that they previously saw themselves as. Like I said, yeah, it just continued to snowball from there. And then on the other side of the coin, it also made me realize as I got back to the sport, there was a number of prominent professional, world tour level cyclists that were retiring from the sport. Their preseason cardiac screenings were causing that retirement because of abnormalities found, or there were events of sudden cardiac arrest, either in race scenarios or outside of race scenarios. And it kind of made me realize if the folks at the very top of the sport can still have these problems, but they also have that kind of proactive layer of protection in the preseason screenings, what does that mean for the rest of us? What does that mean for the aspiring U23 athlete who's on a team that certainly can't afford that kind of proactive protection and may not have access to it regardless, depending on the health system, the country that they're located in? What does that mean for the gravel cyclists where there's not those same levels of structure in that genre of sport? What does that mean for just a passionate rider that's been riding for all their lives and still puts out 20 hours a week? All those athletes are by and large working in a system that's kind of more waiting for something to go wrong before action is taken. And so it made me realize if there's even just small habitual changes that we can make on a day-to-day basis, that can go a long way. And certainly having that awareness that things can happen to us, both Chris and I being living examples of that, I think that also goes a long way to, again, make athletes to think about this type of thing. And then if there is that day that comes when they kind of say, yeah, something really feels off today, or, I saw my heart rate really oddly spike while I was on the ride, it's not immediately dismissed as a heart rate strap problem necessarily, or it's not, just kind of brushed under the rug because I'm an athlete, I'm not, drinking heavily, I'm not partying or whatever. That's kind of given second thought. It's left on the back of the mind. And if that kind of thing happens, maybe more than once, you start to think, okay, maybe I should get a second opinion because now I know I'm not necessarily entirely immune to these types of things developing.
And do you think that data that most cyclists are all, particularly those racing, heart rate monitors are very prevalent, watches, that data that we are driven by as cyclists is useful to the individual in terms of just highlighting perhaps something that is happening that perhaps is a warning?
Yeah, absolutely. And I mean, that's the heart rate strap, again, is one of those heart healthy habits that I talk about as being a very small, not cost intensive thing that you can bring into your daily practice. I think with the advent of things like power meters, heart rate monitors have kind of gone by the wayside. I know a lot of folks have kind of let the battery die and then just left it on the shelf collecting dust, because it's true, heart rate is going to respond differently on a day-to-day basis based on caffeine, dehydration. There's so many different factors. So it is hard to purely train by heart rate, sure. But it is still a valuable data point, especially if something goes kind of sideways down the line. I think the most recent example that is a great reminder of that is Peter Sagan's recent journey, where the heart rate strap is what picked up the arrhythmia in the race. He knows his maximum heart rate is around, say, 190. And it's all of a sudden recording, I think it was in the 200s, well in the 200s. You kind of go, that's maybe worth getting a second look at. That's what prompts an ECG. Then you discover as the tests continue, okay, we have a bit of an abnormality here with an arrhythmia. So even if you're not using heart rate as a primary training metric, even if it's not the primary data point that's on your computer as you're riding, having it in the background, if something ever happens, if a bobble ever happens, you then at least have a data set that you can bring to a cardiologist and say, this is how fast it came on. This is how long it lasted. This is the type of activity I was doing. Was I in the middle of an interval or was I at a more leisurely ride? Cycling computers can bring in dynamics like what was the weather like? You can kind of talk about, was I perhaps a little bit dehydrated because it was a really hot day and I wasn't drinking enough water? And all those little clues can help accelerate the response to thinking, okay, what exactly could this have been? Was this maybe perhaps just an abnormality on the heart rate strap, or was this perhaps something that we need to look in a little bit more? So again, it's a very minor investment, but it can go a long way to being proactive about your heart health.
Yeah, I do know young riders who have picked up post-viral myocarditis, and that's been picked up from a heart rate strap as well. So they are useful even if you're not training on them.
Yeah, exactly.
Yeah. Chris, you mentioned encountering some surprising misconceptions within the medical field regarding athlete health. The conversation in the corridor about you looking so fit, you'll be in and out of here in no time. What were those misconceptions and how did those moments push you to raise awareness?
Like Cody had said, our health system isn't preventative per se. And I always thought this, but it didn't really make sense to me until this happened, is that our healthcare system really isn't made for people like us. We walk in, our doctors know that we're cyclists or endurance athletes. We're fit. We have great diets. We don't have any risk factors whatsoever. So I would go see my cardiologist because I did mention that, the history that I have. And he would say, "Oh, Chris, you don't have to get a stress test. You put yourself through a stress test every day. We don't need to do that. You're good for another 6, 12 months. You don't have to come back." All these things that I certainly can't blame him. He was the guy that sent me for the coronary artery calcium scan and essentially saved my life. The mentality and the mind frame that even I was in, right? I was reluctant to go get the test because I'm a cyclist. Could possibly happen to me, even though I had that really strong history as the only risk factor that was present. I just think that we should be advocates of our own healthcare. That's the primary thing. So there's no reason why we can't dig or ask to get a test or say, what, maybe we look a little bit further into this, because if we don't look out for ourselves, then who really is going to?
Cody, Chris earlier on mentioned the term athlete's heart syndrome. Can you break that down for us a little bit and tell us a little bit more about what that means?
Yeah. So, the heart is like any other muscle in the body. It's going to respond to the stimulus that's placed upon it, the training stress that comes with a lot of endurance activity, intervals, etc. So you're going to see the heart respond to the demands that the body is asking of it, which is essentially to bring more blood to the working muscles, bring more oxygen to the working muscles. Things like stroke volume are going to increase the size of the left ventricle, which is pushing the blood into the aorta, which is going then out to the rest of the body. Those types of changes are a natural response to the exercise we undertake. The one nuance that I've experienced in some of my personal conversations, and it's not, illogical when you put it in this way, you wouldn't talk to a typical person that goes to the gym and they say, "Yeah, I do chest, like I do a bench press 7 days a week. It's the only exercise I do when I go there. And I'm always stacking more and more weight. And it's just always inevitably, indefinitely, always getting better and better." Most of them would know, yeah, at some point, you're probably going to tear or injure a muscle. You can't just indefinitely put more and more weight on the rack and hope that things go well. But that same logic doesn't seem to necessarily translate into the endurance athlete community. I think we think about it as being more is indefinitely good, but I think it's equally important to recognize the importance of those lighter days, those rest days, because yes, athlete's heart is going to be a natural thing that comes, but there is also the kind of wear and tear is one of those kind of developments that can happen over time that can potentially have a negative consequence as well.
So are you saying then, Cody, that recovery days are about more than just the legs?
Yeah, absolutely. It's a whole body recovery. You're letting the kind of central nervous system respond and adapt to that stress. You're letting your heart respond. You're letting your legs respond. You're preparing yourself for the next kind of intensity, the next block of racing. Yeah, just trying to push through 7 days a week or stack infinite more and more hours and not expect something to happen is, it's worth taking those rest days.
It's interesting because the term athlete's heart syndrome was mentioned to me by my cardiologist after receiving, the ECGs and the echocardiograms as a way to just rationalize the changes that were in my heart that could have possibly signaled this earlier. So it's interesting. It certainly is that could be used as a misconception that actually works against us.
So are you saying then that being an athlete could actually mask the condition you may well be dealing with?
I think in my case, it really did, because lengths of time between screenings, I didn't get a routine stress test like I probably should have, those type of things, because I was a fit guy. What could possibly happen to me?
Yeah, it's interesting, isn't it? Chris, you've made an impressive comeback post-surgery. Cody, I'm taking a look at you on the screen here and listening to your story and thinking you too have also made an impressive recovery coming back here post-surgery. Chris, does the visible recovery help or hinder the way people understand the seriousness of heart health?
That was something that I struggled with in the beginning. I mentioned in the introduction that it was the hardest thing I've ever done in my life. Opening up my eyelids after the surgery was the hardest thing I've ever done in my life. It was like climbing Mount Washington times 500, right? That's what I experienced the first day. I was out of the bed in 4 hours, and the physical therapist came to stand me up, and 6 hours after the surgery, and I could barely make it 5 minutes. In true cyclist fashion, I was so upset at myself that I didn't just start, walking down the hallway and then out of the place. But I did do well, and I approached it as if I was training for an A race. In like a day and a half, I was making laps of the nurse's station, and they thought that I was out of my mind. And they sent me home. And when I got home, I didn't have enough strength to basically make it up the incline driveway so that I could get onto the street of my house, because I was so short of breath. But within 8 days, I had walked 8 miles because I knew that I was going to see my cardiologist for my 2-week checkup, and there was no way he wasn't going to let me get back on my bike. To his credit, he worked very closely with me to meet my goals, which were not conventional, which is another way that the health system doesn't really adapt to we do or expect. But he worked with me very closely, and I was back on the bike, and within 1 month I did a metric century, 62 miles straight indoors, and in 2 months I did a full century, 100 miles straight indoors. I kind of struggled with whether that's something that I wanted to tell people, because would that make it so that another cyclist wouldn't get checked because it really wasn't a big deal? But then I had a conversation with one of my friends who also had a very strong cardiac history, but hasn't had any problems. And he said, Chris, what you're doing makes me want to go get a test, because I can see that your athletic career is not over. This wasn't, for lack of a better term, a life sentence to cycling. You're back doing what you want to do. I'm also racing now, but I have a much different relationship with the bike now than I did before. I get on the bike and ride because, basically because I can. I don't get on the bike now because I want to push out intervals and have a high FTP. I do it because I love to do it. And that's one of the ways that this has been one of the best things that's happened to me.
Cody, I'm going to ask you a similar question because, again, another impressive comeback post-surgery. I mean, looking at you here, like with Chris, no one would ever assume the journeys that you two have been through from meeting and talking to you at face value. Because you were only 29 when it happened to you, Cody, how do people respond to you in terms of the recovery that you've made? Like Chris is talking about, does it hinder the way people understand what's happened to you, or does it help get people to understand what's happened?
I think it helps. I know in the early days of my recovery, like my surgery wasn't necessarily forced upon me. There was a strong expectation that I was going to need to have it completed very soon, but I was a big proponent of getting it finished as soon as possible. And I remember in the early days of the hospital stay, as I was stepped down from ICU and the pain really started to set in, that I thought, I could have maybe got another year before I needed this surgery. Maybe if I was lucky, another 2 years. Like, why did I push so hard? The pain was unbearable. Same with what Chris was saying. The goals to get the patients moving right away is a standard procedure. And I remember the first time they tried to get me out of bed, I felt so delirious. I thought I was going to pass out. And then it was like, you need to be able to walk to the doorway of your room and back. And I was like, oh God, this is brutal. And then it was walk down the hall. And every single time I thought, there's no way I'm going to do that. And then every day things just got a little bit better. I had to go up a flight of stairs before my discharge, like be able to walk up a flight and back down a flight. But by the time I was discharged, about 5 days post-op, I was completely back to normal. I mean, there's a video of me walking out of the hospital and I was like just walking with my hands in my pockets, completely normal. There were definitely hard days on the recovery on the other side of that, but I think a lot of the fear I had going into the surgery started to dissipate as the recovery continued. I had a walking program for the first month or so that I had to undertake, and it started with very gentle, 10 minutes 2 times a day, 15 minutes 2 times a day. And eventually it got to the point where I was blowing through the standard set. I remember I was like, basically, like I was walking to one of our favorite go-to cycling cafes, which was about 8 kilometers down the road from where I lived. I stopped, I had a coffee, and I walked back. So I took the cafe ride concept and I applied it to my recovery process. And that kind of dedication, exactly as Chris was saying, I approached recovery, I approached preparation and recovery like training. I used it as that recognition. There's going to be days, in the same way that there's going to be days where your training goes miserably and you feel like it's not hitting the mark that you want it to hit. There's going to be those days in your recovery as well, but you have to look for the big picture and look for the kind of the 10,000 foot progress level that's coming out of it. By the 6 week mark, being back on the trainer, that was a huge milestone. Having my stress test at 3 months, knocking it out of the park, basically having to be told that I had to stop the test. I did it on a bike, and the cadence I had to hold was between 50 and 60 RPM. which once you're getting up at VO2 plus levels is pretty taxing on the legs. But I was still pushing it, but the whole bike was like rocking back and forth on its legs. And they were like, okay, I think you're done. Like your heart rate's in the 190s. You're probably fine at this point. I think I got within 2 beats per minute of my max heart rate, and everything was cleared. And so they said, okay, you're good to go. And that same week, I think I jumped back in. I said, okay, I've been told I'm good to go. So I'm going to start doing intervals again. And then 8 weeks after that, I had 2 blocks of intervals. And then 8 weeks after that, jumped right back into racing. I only share all that because, again, those days, those months leading up to the surgery, I really struggled to that fear of not ever coming back the same way, being on the other side and not being the same cyclist that I was before. I know every journey is different for every individual, but I think there is a benefit to having a couple positive stories out there because those stories can happen. Again, Chris and I are examples of that. And so having that is to latch onto and put some hope into, I think it can help bring that expectation that if they can do it and they set their minds to it, I can set my mind to it and do it as well. And I've chatted now with so many other heart patients who are either preparing for surgery on those early days of recovery. And those are the types of questions. It's like, how did you push through when you were so miserable on week 2 of recovery? Or how did you respond in those weeks leading up to the surgery? Were you as anxious as I am right now? Of course I was. This is what you have to think about. This is how you have to try and reframe it. Keep that positive mindset. When you're dealing with the recovery, there's going to be bad days, all that stuff I just said. And yeah, that's a huge help for other patients going through it. And so many of them that I've had the privilege to connect with, they are back and crushing it on the bike as well. So again, other living examples.
Yeah, talking about crushing it on the bike, Cody, this is a virtual cycling podcast. So we've got to talk about indoor training. And can you share more about the events you're organising on Zwift and how listeners can get involved to support Project Heart?
Yeah. So Heart Month is February in Canada and the United States. It has been for many, many years. And so I use February as I used it as a launching point for Project Heart in its first official year last year. I'm using it as kind of the launching point for season 2 again this year. And we're hosting weekly group rides on Sundays at 11 a.m. Eastern. That's 4 p.m. UTC. And it's just an opportunity for other heart patients that have gone through a journey, again, arrhythmia, plumbing, whatever it may be. We've had several other heart patients join on the ride. Because these are public events that you can find in the events tab, we've had at least, I'd say 50% of the participants were always new folks that just saw a ride at that time and thought, hey, I'll jump on that one. And it becomes this great learning opportunity and chance to connect with the heart community. I kind of moderate the ride and use it as an opportunity to talk about my story, answer questions that folks may have. And then other heart patients have been chiming in and sharing their journeys as well. And it's this chance to celebrate and give space to the resiliency of that heart community and celebrate the success that folks still have regardless.
I'm going to drop that event link into the show notes. And also, do you have a club on Zwift that people that are listening can go and support you in that way?
Project Heart Community Club. And so again, there's several heart patients in there, a number of heart patients in there, and other folks that are just keen to support the cause and learn a little bit more about their own heart health and heart healthy habits that they can adopt.
Just so if you don't know how Zwift works, if Cody doesn't get a lot of people into that club, then he can't get an in-game jersey. So just go and click that box so that he has a little bit more leverage when he brings that idea up to Zwift.
It would be a really beautiful experience to one day see the Project Heart jersey, which is quite a prominent jersey. It's one that you can actually purchase in person as well. We have a fundraising jersey that helps raise funds and support for the University of Ottawa Heart Institute. Folks across Canada and the States have bought that and worn that with pride. That's kind of the way that they can celebrate their own heart journey or support a cause of a family or a loved one or a friend. But to see that jersey encapsulated in that kind of virtual format and see a group of folks riding together, I think that would be really something special.
I'm loving the challenge now of let's get another 300 members of your team on Zwift. If you're listening to the podcast, head over and do as you're told. Anyway, Chris, the virtual cycling community itself, though, has experienced its own share of heartbreak around heart and heart health. And like the tragedy, for example, involving your own teammate. And we were only talking about that the other day. How did that event shape your approach to heart health advocacy? And what changes have been made since in the community to try and help with those challenges?
The specific instance that we had discussed, and there have been several, actually, when you think about it, we're pushing ourselves to the extreme. We're in our basements. Last September, during the dirt racing series, which is a very popular racing series, a rider named Jason, he had a cardiac episode while he was racing. His teammates were on Discord listening to it unfold, and they were helpless. There was nothing that they could do. And a few of the leaders in the dirt community thought, there is something that we can do. And since then, every single team on dirt has a Excel sheet of emergency contacts that we pin to the top of the Discord channel. In the event that this was to happen, we have an emergency contact. We have EMS for the area. Everything is there. We can go in and check it out. The majority of the people that are listening to this, they're recreational riders, they're recreational racers on Zwift, and they have teams and they have Discord channels. This is one thing that you can do to perhaps prevent the tragedy from happening. It's things like that. As a community, we have to come together to do, because this is a problem and we need to raise awareness and we need to do the things that we can do to prevent it from becoming a major tragedy.
And looking out for each other is absolutely one of those things that the community can do. Cody, if you could leave our listeners with one key takeaway today about heart health in endurance sports, what would it be?
I think it is that reality that none of us are immune, despite our passion for sport and our commitment to sport. That doesn't necessarily remove us from the equation when it comes to a heart health complication, whether it be in the near future or in the long-term future. Recognizing and embracing that reality goes a long way to increasing reaction time if something does happen. You don't immediately dismiss it when you feel something is off. And I think equally celebrating the fact that we have a really advanced medical system that can go a long way to giving our lives a lot of meaning and purpose. Even when I was living with the aneurysm, I was medically managed with the aneurysm, like I said, for about a year and a half between the diagnosis and the surgery. I ended up riding close to 16,000 kilometers in that 11-month period. Under that supervision, I had a heart rate limit. I had a kind of riding style limit. So I did have a disconnection from how I previously rode my bike. It still let me ride my bike. I discovered a whole new way to enjoy and appreciate the bicycle. Previously, what was a tool for me to push myself to the limit, find that glass ceiling and break through it, I wasn't able to participate in that aspect of the sport. But I was able to use it as a tool to socialize, to see my friends, to see my loved ones, to take the road that may not be traveled by Google Maps if you're driving to a new location, to appreciate the scenery and the beauty of those roads because you're traveling at a speed that lets you embrace it a little bit more. I totally embraced it. I was completely in love with a whole new aspect of the sport that I hadn't been a part of. So I think regardless of the health journey that you're on, the heart journey that you're on, it doesn't have to end with a specific, I got the surgery, then I was fixed. I don't want to leave listeners with this mindset that Cody's journey was only beautiful because he got to have that heart surgery and go back to doing what he was doing. I was loving what I was doing with the diagnosis before that surgery as well. And I think finding that resiliency within yourself, recognizing that you have a lot of strength and that you'll find a new way to chart your path is hugely special and hugely important.
Chris, what's the one message you'd like every cyclist to take away?
I don't know if I can follow that one. That was pretty good, Cody. Before we had this conversation, I was wondering whether I was going to make it through without getting emotional. I know that I've been on the edge a couple times, but the thing that I've been trying to get across, and I use it kind of as a mantra now, is endurance athletes aren't invincible or immune. If it can happen to people like me and Cody, it can happen to anyone. But also, cardiac surgery isn't the end of our athletic careers. So I urge you, please go get a coronary artery calcium scan. Tell your friends, tell your loved ones. It truly saved my life. So did all of them that were involved in my care, from my surgeon to their nurses. Everybody was so fabulous. The scan could save your life or someone you love. So it is a little bit tough, but my life will never be the same, but it's not in a bad way. And I appreciate everybody for listening to this, because the podcast is a virtual cycling racing podcast, but the main reason is that we want to make an impact, Emma and I. And this is a way, in a very profound way. And I appreciate you coming on, Cody, to share your story. And you've certainly opened my eyes to a different perspective as well. And that's from somebody who's going through it.
Yeah, it's been an absolute honor to be here. I'd be happy to connect with anyone that's listening to this episode and maybe been through a journey themselves. My dream is to make Project Heart a community that empowers those that have been impacted by a heart-related diagnosis, gives them that autonomy journey and lets them retake a part of their lives that they feel may have been ripped away from them. And so if this effort can give you space and give you the home that you need and help inspire you to still achieve greatness, then I've done my job.
Cody, is there a website where our listeners can drop into get information about Project Heart?
Yeah, it's www.project-heart.ca. You can also find me on Instagram at cardiac_Cody. And I've chatted with both folk through the Instagram messaging and Project Heart. The website has a contact me section as well. So there's lots of ways to reach out, and I'd be thrilled to hear from you.
Thank you ever so much, Cody. Thank you ever so much, Chris. It's been absolutely brilliant to have you both here today as guests of the Virtual Velo podcast. But before we sign off today, I am going to add one thing, because I do also want to ensure our listeners are aware of the fact that heart health is relevant to everyone. If you're a young rider or racer, or a parent of a young rider or racer, the International Olympic Committee recommend cardiac screening for any young athlete over 14 years old for undetected cardiac abnormalities. CRY, who are a charity, Cardiac Risk in the Young, one of the charities who offer a screening service for free in many countries around the world. And there are numerous other charities and foundations who exist who also offer these services. Having been part of an event organising team where we had a young racer aged 17 have a heart attack mid-race, these things are really important surrounding young athletes. Please do get your young athletes checked. The racer in question survived. We had medical team on site. He came back the following year and marshalled the same event. It was a wonderful, wonderful thing to see. But unfortunately, I do know too many young athletes who were not as lucky as him. So please do get your young athletes screened. They have to be 14 years old, but there are a wide range of charities and foundations out there offering the services for free. You can subscribe to the Virtual Velo podcast on your favourite podcast provider, or of course on YouTube. You can follow me, Emma Martin, on Instagram at biking_Emma, and you can follow Chris at the McKay. You can catch me putting words to the action at the finale of the Echelon Racing League this Saturday, and we're back for the Sunday Race Club on my whoosh on Sunday. You can head over to the McKay and sign up for the bi-monthly newsletter to support independent cycling esports journalism. We're going to have more interesting guests from around the world of cycling esports joining us. The Ionian team of Carla Williams, Birdie and Driscoll and Ariel van Haren are with us next time. Coming up, we have 2028's Nicola Kramer, Cycling Canada's Josh Peacock, and we've got several other impactful guests waiting in the wings. Thank you very much for your patience if you are one of them. Thank you very much to Cody McKay and Chris Schwenker today for sharing their stories. Thank you for listening. It's been a little emotional today, but we hope you have enjoyed the podcast. Please check out Project Heart. Get a coronary artery calcium scan requested if you think you need one. And endurance athletes, as Chris says, are not immune or invincible. Look after yourselves out there. Take care of your heart. Stay safe. We'll be back soon again. Goodbye.